services they were paying for. Over the years, we tried to maximize federal dollars by moving as many county-funded services as allowed into that funding stream. At first, the state gave the counties the authority to manage the federal portions. Eventually, the state took over the management of those federal portions and the funding of all the services. So today, the state contracts with Polk County to provide information and assistance on navigating the service system for community members throughout a 14-county district. Along with this contract, the Behavioral Health and Disability Services Department has an array of responsibilities for the county. The services we provide come from several different funds. We have state funds that pay for decategorization program, which is a program through Child Welfare and Juvenile Justice, which provides funding to reduce the use of institutional or out-of-home placement by focusing on more preventative and family-centered support. Disability Access Point, also known as DAP, which provides information and assistance on navigating the services system for community members throughout a 14-county district. Judicial Mental Health Advocate, which provides advocacy and support to individuals who have been civilly committed to inpatient hospitalization. We have Fund 1, the general fund, where Global Neighbors is funded. We just opened the multicultural food pantry yesterday. The first day, 39 households were served with 122 individuals of those 39 households. And we are working with General Services to remodel 1900 Carpenter, which will provide a welcoming environment for our new immigrant and refugee community members. Fund 2, General Supplemental Fund, provides a small amount of chemical dependency treatment and prevention through contracts with local providers, such as detox services through Broadlawns and the Sobering Center through St. Vincent de Paul. Fund 2 also funds the Criminal Justice Coordinating Council Coordinator, who organizes the council and who works to bring our different systems together to reduce justice involvement from our community members. Our last fund is the Opioid Settlement Fund. This next fiscal year, we plan to utilize $3 million of the fund for grants and programs. As part of the county, we also provide a lot of support and collaboration to homeless initiatives. I am the chair of the Homeward Board of Directors, and as the chair, I'm a member of the Housing Solutions Alliance Board, along with Supervisor McCoy and Supervisor Conley. BHDS is a Continuum of Care Board agency member, and a BHDS representative is the strategic lead for several Blueprint to Address Homelessness strategies. We have other responsibilities as listed on the slide, which support our community and our county as a whole. Our revenue will decrease from $17.8 million to $10.6 million because some state-funded programs are ending. For expenses, personal services costs go up about 10% because of cost of living adjustments, merit, and health costs. Our non-grant funded operations are up about 7%, reflecting our opioid programming expenses. Grant-related expenses are down 41% to reflect state contracts sunsetting. We work hard to make sure money is spent wisely. The majority of our funding is grant-based, so to meet the 1% Fund 1 reduction target, Global Neighbors will need a $14,000 expense decrease. These changes are not cuts in care. They reflect state-level shifts. We're working closely with the state to make sure people still get the help that they need. We have a separate contract with the state to fund services that we provided as the region. The other regions did not provide. The state asked us to continue these services during the first 6 months of the change to maintain continuity as we work to move those services to statewide funded services. That contract is now ending as those services have been moved to statewide funding or discontinued. Opioid program funding was adjusted to reflect realistic revenue from the settlement as we learned more information. We made a correction to the Sobering Center funds due to a one-time overstatement. Smaller grant adjustments were made due to the discontinuation of the Juvenile Court Pre-Arrest Diversion Grant and a decrease in judicial mental health advocate contracted employee utilization. And the Iowa Refugee Summit Grant was discontinued by the state. These are smart corrections that keep our budget realistic and focused on core services. Changes in services result from state grants, not county revenue. Overall, there is a net expense decrease of $3.5 million versus FY 25-26, driven by planned program realignments and grant sunsets. We have increases in a few areas and will continue to follow the strategic plan for expending the opioid settlement dollars. Those save lives and reduce emergency room visits. This is a smart investment. Every naloxone kit and every treatment slot prevents costly crises. Our personal services increased, and we have requested a decision package for Global Neighbors Security Officer to ensure a safe, welcoming environment at the multi-tenant hub when it opens. These increases are offset by decreases in the ending of the region service continuity contract and the sunsetting of the region, the discontinuation of the juvenile court pre-arrest diversion program, and decreases in the miscellaneous adjustments with the Criminal Justice Coordinating Council budget and the 1% reduction of $14,000 for Fund 1.
Annie, back to, before we get into staff, and I'm interested in this 41% or almost 41% cut. Was that one grant? Was it multiple grants? What were the grants for?
That was the ending of the MHDS region.
Okay.
And then we did those continuity of care services for services that only Polk County provided. It was about $7 million.
Okay.
And over the last 6 months, we have worked to move those into state funding, or those services were discontinued as the state asked us to do.
Okay, so we trued up and adjusted staff appropriately with those
Yes.
so this is really a transition, because this is the first year that we're living under the new budget as
The disability
this-
access point.
right.
Mhm.
Okay, very good.
Yep.
I'm with you now.
Can
Alright.
I ask a follow-up?
Yeah.
So of the services that we were using, or providing, I should say, that we shifted some to the state, but you said some we weren't allowed to. How many services were we not allowed, or could we find alternate areas for that?
It depends on the individual, because each situation was different depending on how the state, because the state allowed to continue some of the services, but it depended on if they were still deemed eligible by the state. So I can't give you an exact number of who all lost services and who, but we tried to figure out services that could replace those that weren't
Sure.
funded by the state.
I guess I'm not asking for the number of individuals, but as you recall, we had a chamber with people
Correct.
that were concerned about one particular service that
Yes.
was going away. Did we lose other particular services that overall went away?
I'm trying to think of all the different, for that service in particular, we were able to utilize a Medicaid-funded service. And so those programs transitioned to either intensive psychiatric rehab or into community support services, which are both funded through Medicaid. So those individuals transitioned into a new funding stream, and the service looks pretty much like it did prior.
Oh, I appreciate that, thank you.
Mhm.
And then, maybe you're getting to this, but how much of your budget is like pass-through? Like the state gives us or we give them, and because
We
it's funded
contract-
with the region now.
Right. All of the money that comes to us, we contract for those services that we provide out through it. So I wouldn't say it's really a pass-through, because we have to manage those contracts and verify that the services are being provided and make sure that that's all happening.
But we're getting the money from the state to
Yes.
do that.
Yes,
So it doesn't come out of our general fund budget?
correct.
So what comes actually out of the general fund budget?
So you would have
There's a lot of
Global Neighbors,
Okay.
and then you would have the Criminal Justice Coordinating Council
Okay.
coordinator, who comes out of Fund 2.
Oh, so those are the two
And
that
then
we're down
Fund
to.
2 has a small amount of substance use services such as detox, sobering center. But for
And we
the,
have partners
did I
with the
miss anything?
sobering center, right?
And then opioid settlement is a totally different fund. It's not Fund 1 or Fund 2.
Right, but that again is money that we get from the state because the state got it from the
That comes
settlement.
from a settlement.
Right.
Yes.
Okay, thank you.
Mm-hmm. Yeah, very little of our funding is actually county dollars.
That's, yes, you have big numbers here, but I didn't think that they were our big numbers.
Right, correct.
Thank you.
Mm-hmm. Okay, so slide 7. We have about 18 full-time employees with a low turnover rate, maintaining a stable workforce. On July 1, we saw staff growth because DCAT and Global Neighbors moved from the CFYS department to our department. and so they have been working for us. So thank you for investing in our community. Your support helped us keep families whole and save lives. These dollars will return value many times over, and lives saved, homelessness reduced, and stronger families. By launching the jail dashboard for the CJCC, it guides data-driven decisions and creates transparency for our community. The Sobering Center served 1,112 guests since opening last November, reducing ER and jail utilization for substance-related episodes. Through the opioid settlement grants that we gave out to providers, we were able to support 1,719 individuals. We provided 12,127 training and outreach contacts through those grants, distributed 15,447 naloxone doses, and we were able to confirm 126 overdose reversals, so those were lives saved. Your dedication to disability services is very much appreciated. Your vision created a system of care that allows us to improve the lives of individuals with disabilities and their families in 14 counties throughout central and southern Iowa. We seamlessly transitioned to District 5 DAP across 14 counties, established a 9-member lived experience advisory council, and contracted with community support advocates for navigation, information assistance, options counseling, long-term services and supports, service coordination, along with our staff completing a district assessment and plan for the district.
Annie, on the, I'd like to go back to the Sobering Center because I know that I've seen estimates and numbers, like we've tried to figure out what are we saving by avoiding emergency room visits and bookings at the jail. Do we have any rough estimates on actual dollars that have been saved?
We'll see if Rachel has that with her.
Okay, that would be great. I've heard the number and I think it's worth repeating. So when you can pull that up, that's great.
Any other questions while she's looking for that?
While she's waiting, so the 14 counties that we're serving, what kind of feedback are you getting from those counties as it relates to their satisfaction with the services? And again, are services being provided to those folks in those communities that have formerly not had great service in the past? And what types of challenges are we facing as it relates to disability services?
Yeah, so there are definitely individuals who are receiving services now that weren't, who are getting connected to Medicaid and getting connected to SNAP and to benefits that they didn't have access to. We have, in one county, we found a whole apartment complex of individuals with disabilities who needed assistance in getting connected to their staff at the managed care organizations. I would say a large majority of our time is spent connecting people back to their managed care organizations and getting them the proper information and that they can advocate for themselves to make sure that the managed care companies are giving them what they need in order to support their lives.
So that's case management? And
it's called information assistance and then options counseling.
So it's navigation and, okay.
It really, our role has really changed from actually having contracts and providing like true services to helping them navigate the system. And so a lot of our time is spent, I think it was around 50% of the individuals have Medicaid, and it's getting them reconnected to their Medicaid managed care case manager.
Okay.
So it's been very beneficial. Rachel, you want to come up?
Okay. I'll just talk. So as of the end of the calendar year 25, there were 1,357 individuals served, saving 3.5 million of ER, 74,000 of jail, which I feel like is a little bit underrepresented, but that's neither here nor there at this moment, and then 35,000 law enforcement hours saved.
Wow. That's tremendous. That's tremendous success. Thank you.
So our vision is a community where help is easy to find and hope is real. With your partnership, we will open global neighbors, expand opioid response, and strengthen disability services. For our near-term, Global Neighbors construction has begun over at 1900 Carpenter. The contract has been signed and we are set to deploy a county-wide targeted opioid response team using settlement funds. And we plan to expand our disability access point information and assistance marketing across the district in order to serve more people. In the long term, we are looking forward to opening Global Neighbors in the spring of 2027. In partnership with the County Attorney's Office, we'll be publishing a County Attorney Dashboard for the CJCC. And we plan to secure a contract renewal with Iowa HHS for DAP District 5.
Annie, just so that people that don't know get a chance to understand, what is the targeted opioid response team and how's that gonna work?
So it's an extension of our mobile integrated health team that was at the goes through the Des Moines Fire Department, but this one is countywide, and it is to, when an EMS or a police officer goes out on an overdose and it's reversed, or then they can notify this team, and then within 24 hours, that team meets up with that individual and talks to them about treatment options and work through that process with them.
That's
Similar to our mobile crisis.
What's that?
Similar to our mobile crisis.
Similar, but it's a full circle recovery support professional along with a paramedic.
Good.
Did I miss anything, Gabby? They'll also start medication-assisted treatment in the field so that they can start that right away and then get connected up with their service provider or with a service provider.
So, who will make up the team? Will that be DMP, Des Moines Fire Department?
Good morning. Yes, it will be a paramedic from Des Moines Fire, but they will be coordinating with all of the other county jurisdictions to respond to overdoses that other jurisdictions initially responded to.
Okay, and so they'll serve the entire county.
Correct. That's a
Great.
huge part of what we established in the scope of work.
And do we know how many typical calls they'll make in a year to people that have had a overdose experience?
I don't have that number in front of me, but recently it has declined, and so last that I spoke to the paramedic, she was saying 2 or 3 a week in Des Moines in particular, which has been a decrease. I feel the last time that I spoke to her about that, they were saying roughly 1 every other day, so maybe
Okay.
there's been a decline, but that's just Des Moines. So there's a handful from all the other jurisdictions per year, really. Des Moines is the primary source of the overdose calls, but we'll have more comprehensive data as the project unfolds.
That's great. Well, I'm looking forward to the results of that, and I hope there'll be lives saved as a result of this work.
Turn it over to Frank.
So I recommend to approve their base target as presented. On the security, I agree that they need it, but that's part of this overall security assessment we're doing. My hope is we won't need to add any new positions, but scale the current resources we have. But we're just working through that. I'm working with Dominic and the Sheriff's Office on that. But we will make sure that there is some level of security there that is appropriate.
Thank
Great.
you.
Any other questions for Annie or her team?
The only comment I want to make is that it's been a year getting through the state and then expanding the region to all the other counties. You guys have done an outstanding job pulling it all together, so thank you for all of that and still bringing the best services that you can to our residents. So you've done an outstanding job. Thank you to all of you.
Yeah, we do appreciate all the great work that your whole team does day in and day out, so thank you.
Sorry, not to re-ask the same question, especially since all the thank yous just happened, now I have a question here. The 17.5 million, how much of that comes from the state through the grants versus how much of that comes from what our budget is?
So the majority of that is sorry, the majority of that is state revenue. I think, we would probably have, I don't know, $1 million, $1.5 million. That would be between, Fund 1 and Fund 2. It is marginal. I can look in,
If you just want to send that to me,
Yeah.
thank you.
Yep,
I
I
think
think,
that number looks a little different, 1.5 versus 17.5, right?
correct. Right, let's see, so our current Fund 1 for 26 is 11.9, and then
And that's from the state?
that's, no, that is everything. So of that 11, there's probably, yeah, it is about 1.5-ish, because there's 10 million
us?
from the state. There's 10 million from the state currently this year. And then that will go down to about, we'll lose about 7, if I remember correctly, from those continuity of care services that are transitioning from the region back to the state for that.
Right, but they're being taken care of in a different mechanism.
Correct,
So
yeah.
it's, we're not losing,
Yeah, it's
shifting
really,
it. Correct.
it's really
It's
the.
shifting to the state funding.
Sure.
It's the Global Neighbors Program that is in Fund 1, that is the county responsibility. And then the CJCC program, which is about 240, I don't remember what the, what Rachel's Global Neighbors is. And then there is the substance use claims that, for folks that are committed, that the county is mandated to pay. And that's probably another, I don't know, 250,000 tops maybe. So it really, I need the full detail, that's just.
Like I
that's
said,
just
you
the
could
gist.
just
Yeah,
email
I
it to
will
me
follow
so I
up
have
for
a
you.
better understanding of that, that'd be great.
Do that.
I appreciate that, thank you.
Yep, certainly.
Thank you very much.
Thanks for your work. Next up, we'll hear from our county treasurer, Mary Wells. Good morning.
Good morning. Go ahead and get started. So for our revenue that we're looking at, we are seeing a slight increase for this year, 4.1%. Oh, thank you. Can you hear me now?
Yes.
So we've got an increase of 4.1% that we're looking at for revenue for the next fiscal year. And that's going to come from a full year of realizing the additional auto fees, the $10 additional extra for what we're collecting on those fees, and also in investment income that we're going to see the interest. It has been going down, so it's going to be around 2% this year, so that's why we're seeing that. We are looking at our personal services. For our personal services, we are still very thankful for the 5 additional staff that we have, and so that's where the increase is going to be seen there. And then for on our operations, we'll have a decrease as we have met our 1% that we needed to do our reductions. And so we're looking at a plus 2.7% overall. Looking at our revenue estimates, we're looking at an additional $735,000. On these, on this increase, again, that's our auto registrations, anticipated tax collections, and some of our miscellaneous interest and fees. These are anticipated fees, check fees that are out there, $8,000. But we are going to see that decrease, as I stated earlier, as we look at our interest investments going down. The market is changing, and so we're not realizing the 5% and 4% that we were previously. So we're estimating around safely, conservatively, about 2%. On our expenses, the PERS services are due to our additional 5 staff that we're having. And so we are looking at, because of those additional staff, a reduction in overtime that we should realize. We have not been doing overtime these last few months, so we are seeing that improvement with having the additional staff. We are looking at a reduced postage amount. We were looking at 2 increases last year. We only had 1, so we just budgeted for 1 for this year, so that's a reduction there. We did have a contractor that we had for last year that was completed in December 31, on December 31, so we'll realize those. And we have our historical expenditures for our reduction in our bank charges. Working with Chase Bank has been a very good for the county. We are being able to save a lot of money since that transition. We do have some miscellaneous adjustments as we went to meet our 1% reduction. This is through some of our advertising and also through some of our publications. We do have a decision package that we're going to ask for overtime. We are still going to need overtime because we still will have people that will have time off. We'll have people that will get promoted. We'll have people that will retire. So as we look, we will still need potential overtime to make sure that we can service the citizens. Now we look at our positions that we have from fiscal year 21 through fiscal year 25. We have had considerable turnover throughout the years. Most of those the turnover can be attributed to one position, our customer service assistant position. And that position for customer service, if you look at national standards, that turnover rate is anywhere from 30 to 50%. So we have done several things to try to mitigate this with doing additional training for our leaders in how we screen individuals. We've done some evaluations or questions that we ask for pre-employment before doing some, adding some pre-employment testing. And those are faring very well. As this year, we are only at 11.7%. So what we've implemented has helped in these reductions of non-retirees.
How many customer service positions then account for this turnover? I mean, when I look at this turnover, it's broadly, so when we stratify it to just customer service, what is your turnover rate then for customer service?
It is depending on the year. So the first year in 2021, it was 100%. And the next year, we were at about 40%, and it went up to about 60% in last year.
Okay.
The percentage of from the 17. So we had 12 out of 17 that were CSAs.
Okay, and what is the time for, training time for a customer service?
They're in a classroom for about 8 weeks. Following
Okay.
that 8 weeks, they go into a rotation for approximately another 8 weeks. And so they're doing that training, and then they'll do side-by-sides and sitting with other individuals. And so they're not fully trained and for about 6 months. And
Okay.
then potentially a year is when they feel very comfortable with in their roles.
And then, so how many customer service representatives are there in your?
42.
42. And so if you have 6 months training in them and they walk out the door, you've lost 6 months per employee. And like when we do the exit interviews and the feedback, what are we learning about their reasons for leaving? Is it interactions with the public, or is it systems and processes that they can't understand or they're struggling with, or what do we know?
Yes, we do know, and a lot of it is interactions with the public. We'll get them out of that to training, and as soon as they get into a window, we've had people leave that same day, and we're like, wow, you just wasted our time. And it's some of the systems as well, making sure they understand that. So that's why we've changed how we're doing our interviewing. We're making sure they understand. In most customer service jobs, you're either customer facing or you're on the phones. In our position, you have to do both. And that's a big difference for a lot of people. So when they're coming in, we try to ensure that they understand you will have to do both. And some people think they can do that, but then they get in there and they don't like it. And so that's why we lose the majority of our folks that come through there. So that's why we're trying to make sure we're screening them better, doing better testing. The typing test has been an indicator as well. The folks that we have lose or had to terminate, they didn't have good typing skills, and typing skills and comprehension kind of go one in one. And so that's where we're shoring that area up, and we're doing a better job. That's why right now we're only at 11.7. We've lost 7 so far this year.
Well, obviously, it's a challenge, and customer service is it's a very tough field, and interactions with the public can be pleasant or they can be really tough. And so I think this is an area where we've got real challenges, ongoing challenges, so.
It's getting better, that's all I can tell you, is we're doing a better job, and our leaders are doing a better job. And we're trying to ensure that these individuals know exactly what they're getting themselves into before they say yes.
Very good. So we'll move on to your accomplishments then.
Yes, so we do have some good accomplishments on our website for our Iowa Tax and Tags. We have scheduled payments where folks can go in and schedule their payments for either their vehicle or their property tax payments. One of the things that was helpful, I think, in our turnover rate as well is reorganizing that back office. None of our staff had their own desks, so you really didn't feel like it was your home. And so we were able to finally get that remodeling done, and so now every person has their own place. They can put up their own stuff and really feel like they are part of this organization and not that they're just renting a space for a minute. So that was very helpful in doing that. We did refresh our training room. That also was helpful. We've got a new learning management system that we're working at. So we have really implemented quite a few things to try to hone in and making that CSA more comfortable, more knowledgeable, and more confident as they do their roles in their position. Also bringing that in with those new additional employees, we've been able to reduce the times that we have customers waiting. So we've been able to add back in appointments. So we didn't have enough staff, so we couldn't see as many people. Now we've had it in 100 appointments a day, so we're seeing quite a few more individuals due to that, and that our people are staying and not, we don't have as high attrition rate on that. So we've initiated our training satisfaction scoring, so we want to hear from our trainees as they're going through training. We make those adjustments, and our scores are higher. The last class scored the highest that they have on comprehension of what they understand. The CSA position is not an easy job. You have to not only know Iowa code, but you need to understand the codes for other states as well as international. So making them as confident as we can once they come out of that training room has been one of our goals. And we attend in the community. We're averaging about 3 customer-facing events. We're going out to talk to citizens to ensure they understand and know what our treasurer's office is doing and how they can come and visit us and how we can support them. For our dealers, we've added a dealer point of contact to help. We were losing some of our dealers as any county tithing bill is problematic, because if our citizens go to other counties, we lose that revenue. So we want to do everything we can to keep our dealers, to make sure they're sending their titles here, and our customers are sending their titles here. So we've opened up additional windows to do that, to make them feel comfortable on doing so.
I did have a question on that, so do we understand how much money we have lost as a result of individuals taking their business to other counties in the area? What do we think the penetration has been?
So if you look at any given day, so last week, one day, in that week, we lost 600. So 600 times 1250 is what you get, and
Okay.
it's substantial.
Okay, and have they stated the reason why they're going to other counties, the dealers or individuals?
Yes.
Is it mostly individuals or is it mostly dealers? I'm sorry.
I think it's dealers now. It was individuals initially, and it was individuals initially without having enough staff. Your appointment times were out to a week, 3 weeks. Now you can get in same day or next day to be able to do that. So we're winning those individuals back.
Okay.
On the dealers, if the dealers can decide, they can send their titles to any county they want to. And so most dealers try to, if you go buy a vehicle, they'll usually send it to the county that you have your residence, but they can just do whatever they want. So most individuals don't even know dealers have that option, and so that's where they're ending up with plates that are not Polk County. You'll see Jasper County, Story County plates, and they may not even know that's the problem, that that's what happens. So that's one of the things we're doing, a campaign to educate citizens to know that when you do go buy your vehicle, make sure that you tell your dealer that you want a Polk County plate and to stay Polk proud. So the other reason some of the dealers left is they were wanting to get their money back a lot faster. So if we are not processing timely, then that holds their money up. So we are able to get everything processed timely now because we have enough staff to ensure that we're getting everything processed as quick as possible. We're only a couple of days behind, and with electronic as well as code titles that come through here. So adding the staff has been the turning point for us to improve.
Okay, so are the really big Des Moines dealers, are they staying in Polk County, or are they going elsewhere? Like a
mostly
Carl Chevrolet, is
Carl, we have Carl. One of the ones that we do not have right now is Bob Brown and Copart. Copart is a huge one for us, and they can make the decisions themselves, and their clerks can make the decisions that wherever they want to go. So again, we're building those relationships to ensure that we are here, and we're wanting our citizens to apply pressure to say, keep our money in Polk County.
okay, but we're talking to them
Yes,
all the time?
yes.
Okay,
That was the whole point of having that dealer point of contact.
okay.
So we've also been able to collect property taxes 5 days earlier. Collecting that money means we can draw interest each day on that, so that has been a win for us. And also deploying laptops to our staff. When we deploy those laptops to our staff, we don't have the system issues that we have every day in the morning. So this gave us about 15 minutes of productivity back to everybody in there. So we're able to get in and get started right away without any issues. So we're able to support, and again, this allowed us to add more appointments back into the schedule. Are you in thought, Matt?
No,
Okay.
I'm curious as to, and I continue to be curious as to, when we receive the payments on a daily basis, is all of the mail opened that same day and the checks pulled and deposited?
No, our mail gets here, and that's one of the things we're looking into to see if we can get caller service. So our mail does not arrive to us till sometimes like 3 o'clock in the afternoon.
Okay.
So we're getting it pretty late. So our goal is to get it in at least within that 24-hour period. So as soon as we can get it here opened up, we can get it processed.
So if a person told me that they sent a check in to the treasurer's office, and from the time they sent the check and wrote it to the time it got deposited, it was 3.5 weeks, would that be unusual?
It could happen. I don't have control of the mail, but once it gets into our office, it doesn't take that long.
Okay.
And we do have a problem with that. I know with the new vendor that we went to at POS, there is a tracking one, at least for the vehicle statements. We can track to see postage when we send it out and when it's coming back. But we don't have any tracking for an individual that can put something in the mail and to us. When we receive it is when we receive it.
No, but I meant from the time we receive it.
By the time we receive it, it's processed within a couple of 48 hours.
So within 48 hours, it's deposited?
Yes.
Okay. So, okay. I'm getting bad information from people saying that, you know, they're seeing checks pen from the time we received it up to 3 weeks, and I was like, that seems like a long time.
I would like to see that, and then we don't have anybody bringing that type of issue to
Okay.
us. The issues that we've had, if we have not received people's checks, and so we can't, again, you put it in the mail to us, if I don't have it, I don't have it.
But you're turning them within 48 hours?
48 hours.
Okay. All right, opportunities.
So our upcoming opportunities is we want to establish recurring payments, so we're working with IT to get that established, and hopefully we'll get that done in the next couple of cycles. We are introducing a hybrid work schedule. That is one of the takeaways from feedback from people that have left, and they have left because they were able to work from home. So we want to try to have some opportunities where there's that built into schedules. We are looking at continuous learning opportunities, again, with the new LMS system and our trainer. We're going to continue to develop our staff and leadership. And then also we are working with our IT again to do a new FORM, our Forum Operations Response Management System, which makes it a lot easier to get information sent to customers when they're missing information. Long-term, we want to do front-end scanning for title work so that we can get everything scanned right in initially. So if we've got a question, we can go right into the system to see that scanned in without having to go through a file. And then implement the scanning process for all of our physical records to electronic. So that's what we continually do. Some of the pictures you'll see are of the remodeling that did take place, where we now have every individual having their own cube or space to work. This has been very well received by staff. We also have our cash management room where it's easier for us to move money back and forth, and for our CSAs to get their information and their start of day and end of day processing, along with a place to house our plates. And we also did our work area where we do our processing and opening of mail for our administrative staff. So that area was also redone, and it's more effective for folks where we don't have any physical issues for them doing their processing.
Very good. Recommendations?
Yes, my recommendation is to approve their base target. They complied with the 1%, and then I would also recommend the overtime to give them the flexibility. That's based on actuals and trends, and so, as Ms. Wells stated, there's a long onboarding and training program in place, so the overtime helps them a lot, and I think it is necessary.
So on the overtime, the 130,000 that we saved by the 5 positions, that's built into the base. Now, this is new overtime considerations for the new overtime, right?
Yeah, this is additional overtime, but we forecast that to go down over time.
Okay.
After these individuals are trained for 12 months and after they're fully staffed, we should see a reduction. But in the meantime, they really need this to continue just everyday operations.
I'm with you. Mary, do you see a day when people will be capable of working from home and doing the job of working for the treasurer's office?
I do. In the capacity that we can do that, there are electronic tiling processing, so they have everything in that laptop. That's why one of the reasons why we transitioned to laptops, and we can do our phones. Our phones are just doing there. So this again is something to keep our CSAs happy and wanting to stay in their roles, because we're giving them an option. But we do see that happening.
And do you see a role for artificial intelligence in the future, changing your processes and systems to the point where it is less taxing, less onerous in terms of physical employees in an office? Do you see that happening through changes that are going on in other states, or?
I can't answer that question right now. The complexity of what our CSAs have to do, and there's a lot of gray areas where there's a lot of decisioning. I would hope AI could assist and help us with some of that, but at this juncture, the treasurers that we've worked with across the state of Iowa, we have not entertained or looked at that as an option right now. We are working with the DOT with their new MVD 360, where they're adding a new system, a new ART system for vehicles, and we're working to move more things electronically to help with some of that decisioning, but AI is not a part of that at this time.
Okay.
You know, I would just say that we've made a lot of decisions in the last year trying to make sure that both our employees and our citizens are well cared for. I'm glad to hear that the revamping of the treasurer's office has been positive and that your employees appreciate that. We're seeing less turnover. You know, we've opened up the parking lot. To hear that you have taken that timeline down to, you know, next day appointments instead of 3 weeks, I will say that I have gotten a lot less concerned emails about it, so thank you. It sounds like the you know, we're seeing the difference both with our employees as well as the community.
Thank you.
Very good. Well, thank you very much for being here, and thanks for your work.
Thanks, Mary.
Thank you.
Next up, we'll hear from the county attorney, Polk County Attorney.
They're in the hall.
Oh, they're in the hall.
I saw somebody in the hall.
Okay. Good morning. Is your microphone on?
And then just that clicker right there.
Okay. I don't know, I think I can, hopefully I can manage. Let me know, rescue me if I start really going back and forth with the slides and getting out of control, okay?
I think you just need to advance the slide one.
All right.
Oh, yeah, there we go.
Fabulous.
You're on.
All right. Well, good morning.
Good morning.
All right, so we got a lot to cover, so let's get rolling here. First slide here, our budget summary. This is current versus requested and/or anticipated or estimated in the case of the revenue. There's just a couple things on this slide I want to just point out. One is that, as you can see, the majority of the increase is due to personal services, as I'm sure is the case with the whole county. That is just increases in salaries, benefits that are going to go up year after year. I'd like to point out a couple of notes here. The capital/IT Carpel Fund 55, that is the prosecutor by Carpel software that 77 of Iowa's 99 counties currently use, and we don't. The AG's office also is going to be using that, and we don't. And that would be extremely helpful for us to have, and Brett Lucas is going to talk about that more in a little bit. Also, my understanding is that the $444,000 includes about a $300,000 one-time initial expense to get that going, and that's going to come from the IT budget and is actually allocated as an IT expenditure because it's going to save IT a lot of work down the road. And then number two, I just want to point out that we were requested in this budget to reduce our Fund 1 expenditures by $139,000. That would have been a 1% decrease. We've actually reduced our Fund 1 expenditures by $154,000, which is 11% over what the board requested that we reduce our Fund 1 by. So we're very glad that we've been able to do that. The revenue estimate, basically that just states that we anticipate a $78,000 increase to our revenue for this fiscal year. These are requests. They're going to include, as I mentioned, the cost of living increases, anniversary merit increases, benefits, et cetera. We've also been able to reallocate several positions that work on substance abuse and mental health commitments from Fund 1 to properly allocate them to Fund 2, and that also helped to reduce our Fund 1 expenditures. Then we have a de-appropriation of Civil Claims Council, and then decision package requests that we'll get into here in a second. The decision packages that we have are a request for 1 full-time social worker, which would come from Fund 2, 2 assistant county attorney positions that our Bureau Chief Megan Guns will talk about here in a few minutes. Most of that will come from Fund 1, a little bit of that will come from Fund 2. We've got a request for additional funding of $20,000 for continuing legal education, which is required to maintain our attorneys' licenses in the county attorney's office. And then, as I mentioned earlier, the Carpel software subscription. And then we've made a request for temporary funding from September through December of this year for Claims Counsel, because Mary Culver has let us know that she will be retiring at the end of December. We've talked about this yesterday. She'll be providing me her official letter in July, sometime around there, so that we can bring someone on board. So when she walks out the door at the end of December, we've got somebody who's spooled up and ready to go, and we're not hanging there with just one Claims Counsel, because that's going to be too much for Julie by herself to be able to handle.
So tell us about the software. I'm interested in hearing more about what the software is and
Yep.
what we're currently using and,
Yep.
and where we're going.
We got so much detail coming to you, Matt. It's a couple more slides away, but we're gonna get there. So if you could just hold on just one sec, we've got a whole thing about that. So this next slide, I believe HR put this together. So I guess the only comment I have on that is, you know, we're really lucky. We, unlike a lot of prosecutors' offices in the state, because we're the largest and we are able to pay people a decent salary, we don't have problems retaining people. We don't have problems generally hiring people. Unfortunately, a lot of prosecutors' offices across the state get no applicants when they need support staff and attorneys, or they get very few, or they don't get qualified applicants. We don't have that problem. In fact, we hire applicants that are so qualified that 3 of them on this, of all these people who've left, have become judges. So often people leave our office and become judges and go to other positions. A few of these folks we hired and they left before their 6 months was even up. And these were mostly, I think these were all support staff. So we had some of that as well. Okay. The social worker. So in discussing this with the rest of the management team over this past year, we've realized that we actually have more critical needs than we had thought initially when I first requested a social worker a couple of years ago. And we've also realized the intensity of that need. Namely, we've realized, because another prosecutor in Sac County had brought this to the attention of all of the prosecutors' offices in the state, that there are a lot of child abuse referrals every year that are rejected by the Department of Health and Human Services for various reasons. But in Polk County, the largest county in the state, that number amounts to 10,000. There are 10,000 child abuse referrals every year in Polk County, and approximately 35% are rejected by the Department of Health and Human Services. Those rejected cases are not reviewed as thoroughly and quickly as we believe they should be. And we currently don't have the capacity to review all of those cases with the staff that we have in our juvenile division. We would love to be able to do that because we believe that we're going to find at least a few that have slipped through the cracks that really need more attention and that these kids deserve better. So that is one thing that we would hope that we would be able to assign to the social worker, is to review those cases and give them another look. When we do that, you know, we're able to catch some of the cases that maybe at first glance may not occur to everyone as something that needs more attention, but us, with our experience actually prosecuting child abuse and neglect cases, they're gonna be things that are gonna kind of ping us, and they're going to mean more to us, and we're going to take care of those. So that's one thing that we would like to do. We also would like to have somebody to be able to support our misdemeanor diversion program. It's called Alternatives. We've had it going for a number of years now. I've talked about it, I think, last year to all of you. The statewide recidivism rate, just in general, is about 30%. And this is a low-level misdemeanor diversion program. And through this program, the recidivism rate for folks who've gone through our program is 7%. So we've been able to really reduce crime in Polk County, make us healthier, make us safer in that way. And if we had a social worker, like they do in Story County, so Story County has we copied their program, except they have a social worker and we don't. So we're just trying to kind of winging it and doing our best, but they actually have someone in Story County who can hold these folks' hand, connect them to the services that they need, connect them to treatment, mental health services, follow up, and that's the critical part. Make sure, did you get to that appointment? Did you get those medications refilled? And when you do that, when you kind of help these folks that need extra help, you can make our county safer and healthier. So that's another thing that the social worker would be able to do. Another thing that they can do is work with victims of human trafficking, and that's incredibly important to us. Which kind of leads us to Megan Guns, our bureau chief for our Major Offense Bureau, which includes prosecution of human trafficking. So I'm going to have
Before you switch slides, may I
Megan
ask
take over.
2 questions?
Yeah.
One, it's going to sound really naive, and I'm sorry, but like, if the DHS is rejecting the cases, is there any problem with us coming in and trying to supersede that and handle
No.
the case?
No.
Oh, we can do this, okay.
Mhm.
The other question I had is, when you talked about the 7% for the recidivism, if they've
Mhm.
gone through the program,
Mhm.
how many people have gone through the program?
Oh, I think we got a slide on that later. Hold just a second. Since late 2023, we've had 591 people go through alternatives.
Okay. Thank you.
Mhm.
Good morning. My name is Megan Guns. I am the Bureau Chief of the Major Offense Bureau for the Polk County Attorney's Office. And I am here requesting that we, as part of our decision package number 2, that we add 2 additional attorneys for our Major Offense Bureau. Our Major Offense Bureau covers our human trafficking, domestic abuse, sexual abuse and exploitation cases, crimes against children, which would include child endangerment of all levels, our dependent adult abuse, kidnappings, and any homicides that are related to any of those types of offenses. Our caseloads have substantially increased in recent years, and our caseloads, frankly, have increased across the office, but in this area in particular, and I'll get into some of those specific statistics in the next slide. But one of the reasons that our caseloads have increased is, frankly, some of the legislative changes that we've seen over the last couple of years, which have given us additional tools to prosecute. But that means that those, frankly, those changes have increased the times that cases have sat in our office because people are fighting those cases a lot harder. These are all offenses that I've listed up here. These are additional new charges that have been added. Human trafficking, the penalties have increased, for example. Those, that is now a Class A felony. It's the same as a homicide in the state of Iowa. That did not used to be. Used to be a D felony, or basically the same as some of our lower level drug offenses. It now is the same as a murder. Some of these other offenses are now, have been added. Those are all forcible felonies, which means that prison is mandatory. Those have been added in recent years. Those all come to our docket. Those offenses some of those also, are those offenses also include offenses that allow law enforcement include language that say or law enforcement acting as a minor. That has been added to about 5 different offenses within sex offense language. What that does is allow for law enforcement to act in sting operations, as we call those. Sting operation allows for proactive law enforcement or proactive policing. That's great because it allows for us to detect predators in our community and have a safer community. But that means that more cases are coming into Polk, into our office and into our bureau that are not necessarily victim cases, but it's cases coming into us that we are dealing with. Specifically, we have one agency that brought about 75 cases in within the last year. That's one agency. There's multiple agencies doing these sting operations. Those are all cases that we're having to process through with the same number of attorneys. When I talk about our caseloads are increasing, we disposed of, and when I say disposed of, that means they're pleading guilty or we took to trial, 29% more felony sex offenses in 2025 than in 2024. We disposed of 30% more felony domestic abuse offenses in 2025 than in 2024. Our felony dependent adult abuse cases were up 9% from 2023 to 2024. These cases are increasing. We're getting more and more of them into our door. That's with the same number of felony attorneys. And I'm going to tell you that these are very conservative statistics. And part of that, Mr. Chairman, when we're talking about the statistics and the software, Brett Lucas is going to talk about Carpel and the need for that. It ties into it because our case management software assigns only one case type to each of our cases as they come in. And so our software doesn't allow us to search within our cases as to the different charges that we've charged. So we actually can't go back and figure out how has the case been disposed of, how have we actually gone through. So it doesn't allow us to actually draw and pull out very good statistics from the software that we actually have right now. So it's really hard to track. So I was going through and actually asked the judicial system for different statistics for our office. And this is what I was able to gather. But I had to be really conservative because, for example, murders, attempted murders, willful injury cases, kidnappings, all of those that I know exist for our office and would be sexual abuse or domestic abuse related, I can't tell that those are assigned to us because they are not distinguished as a sexual abuse case or a domestic abuse case. They're assigned as a homicide. They're not actually a sexual abuse case or they're not a domestic abuse case. So none of that is distinguishable. So this is, when I say this is a very conservative number, this is extremely conservative because I'm only looking at a case that is classified as only a sex abuse. So.
If I was gonna ask you how many cases, because I was gonna ask until you got to that.
Yep.
How many cases you have under these new legislative changes, you're telling me right now you can't?
We can't even pull those numbers.
Can't tell you.
Our software doesn't allow us to pull that because the statistics, our software doesn't, we can't go in and track by charges. Our software doesn't allow it. So I just want you to know that these are very conservative numbers. I spent a lot of time and a lot of hours trying to pull as much as I could for you, even asking the judicial system for all of their numbers, and this is the best I could come up with for you.
But this one, no. How many assistant county attorneys do we have actively working on cases that would fall under that regime?
In this bureau, we have 8 county attorneys. We have 6 of them that are assigned to felony cases. We have 2 of them that are assigned to misdemeanor cases. As I have out here, the felony docket average caseload is 60 to 70. Now that is what they are working at any one time. That is not what they work per year. At any time one of their cases closed, they're gonna be assigned another one. So at any one year, they're gonna work hundreds of cases. The misdemeanor cases, they're gonna work probably up to 1,000 cases a year. Those are way over the ABA and the average caseload that are actually recommended for them. This is also a bureau that goes to trial. The Polk County criminal courts gave us the number of trials that happen in this county. 2/3 of the criminal trials that happen in this county are in this bureau alone. And that was in 2024 and in 2025. And by the way, last year, that happened with 3 of our attorneys on FMLA for a substantial period of the year. This is a bureau that is not afraid to go to trial and keep our community safe, because as you can tell from the types of cases, these are trials and these are people who are wanting to keep our community safe. but we need more attorneys to do that. Sorry, I apologize. I want to go over real quick, in January, those counts alone, of those numbers, 31, this is just January so far. 31 of those cases that have come in, those are forcible felonies. That's murders, attempted murders. Those are kidnappings, sex abuse of kids under 14, creation of sexual abuse material, willful injuries, child abuse causing serious injury. 31 of those cases so far have come in just January to these 6 attorneys. That's what we're dealing with. That's 1 month. I will tell you, by the way, we've already attempted to handle this in-house and trying to decrease our numbers. We used to have a full-time attorney assigned to the Polk County Jail because there is a courtroom out there. Some people don't know that. And we went ahead and pulled that assistant Polk County attorney who was assigned full-time to the Polk County Jail and brought her back in-house to the Polk County Attorney's Office and assigned her a full-time caseload and dispersed caseload amongst the office. And then reallocated caseload. And now we just have people cover that shift daily. We have somebody go out every morning and cover the caseload in the morning, and someone go out and cover the caseload in the afternoon. We just cover shifts out there. So we no longer have somebody assigned to the Polk County Jail. What used to be a full-time attorney out there is just covered by the rest of the attorneys. So we've already tried to find a solution in-house to decrease our caseloads by finding a solution in-house. So we're kind of scraping the bottom of the barrel with trying to find a solution. Our increased time demands goes to say that with these increased cases have increased time demands. In each case has more depositions. Especially with the chances of being on a sex offender registry, facing mandatory time in prison. If they're gonna go to trial, that means that it's just more time. It's more time to develop that case. I put on there the State v. White decision. For those that are not aware, we are the only jurisdiction in the entire nation, the state of Iowa is, where, and that's state or federal, where minors have to sit in the courtroom to testify. So that means if we have a case with minors, we have to prep that child to testify in the courtroom. 7 to 10 meetings, many of those off-site. We're not gonna first time we meet with a child, bring them into our office, into that scary environment. We're gonna meet with them at their school with a guidance counselor. We're gonna meet with them in an environment that's comfortable with them. But that means we're traveling to them. That means we're meeting with them in environments multiple times. So we are prepping that child over and over again and working with them to get them comfortable, because we're gonna have to ask them to come into a courtroom and face their accuser in a courtroom in order to work with them. That's time.
mandatory?
That's mandatory. There's no way we can get around that. It requires a constitutional change, not even a legislative change.
Which they're working on.
They're working on that, but the earliest that'll be in effect is 2027. So there's nothing we can do about it. It's if we want to prosecute sex offenders, human trafficking, cases against minors, we have to work with them, and so that's time. It's just a lot of time on our attorney's hands.
Would that be something else a social worker could help you with?
Absolutely. Absolutely. Look for resources for counseling for those children, look for all different kinds of things that a social worker could absolutely help us with that. One of the other aspects is that we realize that a lot of these offenses are very serious. We do work with law enforcement as a whole. Every sex offense is reviewed by our office before it's charged. Because we want to ensure that it's appropriate to charge it before it is charged. We review warrants across our whole office, across all charges, but this docket, we do review a lot of the charges, almost every one of them before they're actually filed. This goes across a whole. This is not just unique to our bureau. Goes without saying, body cams, dash cams, they're invaluable. However, they lead to hours and hours of video. So when we have dash cams, body cams, forensic interviews of children, interviews of witness, security footage, all of which is going to be watched by attorneys. The more that technology changes, the more time and effort that our attorneys have to do to watch all of that. They have to watch that footage and know it exists. They have to turn it over to defense. That's just time. So the more technology changes. The last thing I have up there is the community involvement. Needless to say, Polk County has some of the most experienced prosecutors and some of the best prosecutors in the state. They are often called on to present at CLEs across the state on these topics. Their knowledge is sought on community and professional organizations. I have just a smattering of the ones that they're involved in. That's the human trafficking, a lot of acronyms. We love acronyms in the legal profession. That's the Child Sexual Exploitation Commission, multidisciplinary team. We identify and try to prevent children who are at risk to be trafficked in the Polk County area. Persistent child abuse and neglect, multidisciplinary team, trying to get education out. Child death review team. The SART is a sexual assault response team working with law enforcement. Attorney General's domestic abuse lethality assessment tool group. They are trying to develop a tool to help law enforcement decide if this is a case that is at risk for that victim becoming at risk of being domestically, a risk of homicide. So these are prosecutors who are involved in much more outside of just prosecuting cases. Their expertise is used in the community. Last thing I want to say is the mental load. These cases are tough. These cases are statistically cases that are most likely to lead to homicides when we're talking about domestics. These are cases when we're talking about human trafficking, when we're talking about sexual abuse. These are cases about community safety, and these prosecutors do not want to plead cases. They want to go to trial on them. They want to ensure they can prosecute them to the fullest, but we have to have the staff to ensure that they can do that. We have to have the numbers. But they're difficult, they take a toll on these attorneys, and we need to have the numbers of attorneys to handle the caseload. We care about our employees. We want to make sure we have the number of staff to be sure that we can continue on with the number of increasing cases. So thank you.
May I ask a question?
Absolutely,
So you mentioned a couple times the collaboration with law enforcement.
absolutely.
So the social worker, if a law enforcement person went out for the same call, say 8 times on a runaway, can the social worker step in before they get returned to the home again and say, hey, why are you running away? I mean, would they have that capacity to, is there that intersect between the two departments that the social worker could work preventively, perhaps on those kind of cases too?
We can certainly figure out what the exact or the parameters of that job would be, but that could certainly be something we could look at, having those parameters be set up to work with that.
Thank you.
Yeah, that's a really good point to make, Supervisor Altringer. A couple of years ago, there was a young woman, this is her, Alyssa Mayer. She was autistic, extremely vulnerable. She was homeless a lot. She was stabbed to death in a motel across the street from the Iowa State Fair about a week after she was released from the Polk County Jail. And I'll never know, but I at least know that if we'd had a social worker, we would have been able to connect that social worker with Alyssa as soon as she walked out of the jail, and we would have had somebody assigned to her, and we would have done our best to get her somewhere that she needed to be that was safe for her. And we didn't have anyone to do that. Her defense attorney, bless him, told me that he really believed she was being trafficked, and it sounded like from some of the circumstances in which she was found, she probably was. And he tried to help. He knocked down every door trying to find her help, and he was unable to find her the help that she needed. And she ultimately lost her life. And I know that may sound overly dramatic, but it's true. You know, it really happened. And her mother and sister have given me permission to always talk about her, because we don't want to forget her, and we don't want to forget that maybe we have the chance to prevent some of these tragedies sometimes if we have the resources in place. And the reason why may be annoying, I know this is the 3rd year I've asked for a social worker, but if I didn't believe so fervently that this was actually going to save lives, and dramatically change some people's lives for the better, because I've seen social workers work their magic for years. As when I was the attorney for children who are abused and neglected for 5 years in the Polk County Recovery Court program, right before I became county attorney, and for 20 years before that, when I represented both children and parents in child in need of assistance cases. So I worked closely with my clients and with social workers my entire career, and I know how important they can be to changing people's lives. So that's why I continue to ask. So on a lighter note, the continuing legal education, every year, the Iowa County Attorneys Association puts on 2 conferences that are only aimed at prosecutors in the state of Iowa. That's the only thing they talk about, that's the only training they do. And there's 2 conferences, and the less expensive of which is the fall conference. We call it the fall conference because it's in the fall. And we currently cannot send all of our attorneys to either the fall or spring conference every year. We can't even send all of them to the fall conference, which is the less expensive one. We would need $59,295 to send all of our attorneys to the fall conference, and we have $38,385 in our continuing legal education budget. And that's important because laws change every year. We learn things from each other. We network with each other at these conferences. We also, a lot of our prosecutors present at that conference. We're able to share our knowledge with other people as well. So we're asking for $19,905 to be able to do that. And then the prosecutor by Carpel, you'll hear us call, we do love our acronyms, you'll hear us call it PBK, prosecutor by Carpel or Carpel. We would like to make the transition to a software system that will allow us to gather data, allow us to be transparent with our community in the cases, the number of cases, the way that we dispose of cases. And right now, our current software system that's from the 90s simply doesn't allow us to do a lot of the things that we really need to do. And it also is going to save us a lot of work on part of our support staff to be able to come into the to come into modern times with our case management system. So I'm going to have Brett Lucas come up. Brett Lucas is our indictable misdemeanor bureau chief and intake and screening. So while Megan is the bureau chief over some of the most serious and high-level crimes, felonies in our docket, Brett kind of has charge over the greatest number of cases, because the lower level cases, of course, are the greatest in number. And so Brett has charge of that and a lot of other things in our office.
Morning.
Morning.
Like she said, my name is Brett Lucas. I've been at the Polk County Attorney's Office for 26 years. And I'm going to talk to you about our request for the Carpel software. Over the past 2 years, I've worked closely with our information technology folks to try to explore a more efficient, better way to do things in our office. And should any technical questions come up, Adam Dreher from IT is here, and he can talk the nuts and bolts of it if the board has any questions about that. So as she stated, we are currently using a case management system that was developed in the 1990s. My entire tenure in the Polk County Attorney's Office, we've used this judicial dialogue system. It's the case management equivalent of a Pac-Man machine. It's a DOS-based system that just doesn't work well. It's incredibly antiquated and really hasn't grown with the technology changes that have come with the judicial branch. As we've transitioned from a paper-based system into an electronic filing system, all of those things, we've had to kind of cobble together a series of programs to make our case management system work with the technology upgrades that have come from the judicial branch. So we have probably 3 or 4 supplemental systems that kind of run outside of our case management system, that one of which was developed by one of our prosecutors in our office, who is a kind of freelance part-time programmer guy, but a brilliant person in that regard, and was able to kind of put a patchwork system together to talk to our case management system, but then do all the filing functions and things that our existing system can't do. And IT has also developed a number of programs to work independent of our case management system, or I shouldn't say independent, dependent on our case management system, but we'll extract the data and then put it in a usable form for us so we can do our filing. The reason I talk about filing so much is it's such an onerous task to file stuff when you have to create documents, put them into a package that is accepted by the court, and our current system just doesn't have the ability to do that. So we've had to kind of develop it on our own. Really, none of our work can be accomplished within our case management system as case management systems are intended. We have to do it in these peripheral programs and then dump it into our case management system after we've done the work that we need to do outside of the program. Presently, IT has allocated a 3-month run of 3 developers to enhance our peripheral systems if we don't make a switch to Carpel, because they're starting to lag behind again. They're anticipating that's roughly going to be an $80,000 expenditure from IT to simply put Band-Aids on our current set of systems that we're operating. I would also add that judicial dialogue in its state we use it now is, not that it matters, but it lives on each one of our computers. We all have a program of judicial dialogue on our computer. It's not cloud-based. And judicial dialogue is going away from that model. They're going to a cloud-based system, and they're requiring us to go with them on that. The cost of the transition, whether we want it or not, for that is going to be $98,000. And it's really for a program we don't want and can't really use. So it's our position that, you know, when you look at that $444,000 number, $98,000 of that can be cut off because we're going to have to spend that anyway if we stick with our current program. And we've had a number of kind of test runs with representatives from Carpel. We've gotten our support staff involved to see what it can do, see how it will make their lives easier. The consensus seems to be that it will probably be a 10 to 20% reduction in their current workload. Just because of the automation that exists within it and their ability to communicate with the judicial branch. And we believe that should we make this switch, it will limit our future requests for additional secretary and legal assistant support staff. 77 counties in Iowa are currently using Carpel. That'll be 78 as of next month, as well as the Attorney General's office. So it's really become kind of the statewide standard for work with the judicial branch. In essence, it's kind of created a coalition of counties. So when we need an upgrade, when we need an enhancement, something like that, we have 77, 78, counties that are asking for one thing. If we stick with our judicial branch model, or I'm sorry, our judicial dialogue model, if we need an enhancement, if we need something, we have to do that on a one-off basis and ask for that enhancement. Judicial branch has to program something that will communicate with our kind of, last man standing case management software. So it comes with much greater expense if we need those types of enhancements. So while we appreciate it, it is a significant year one expenditure. We believe that judicial dialogue will not continue to serve our needs. We can eliminate months of work from IT for our peripheral programs. And I think over time, ultimately, we'll end up saving Polk County money in our lack of need for additional staff in the future and just the efficiencies that we'll create. And I'm happy to answer any questions you have.
Brett, I'm sensitive about the time. What I want to do is bring y'all back to continue this dialogue, because we're coming up on a scheduled 10:30 meeting, and once that happens, we'll get you back on the schedule, because I don't want to rush through your presentation. I'm looking ahead at the slides and see what is ahead, and I think we need to have some conversation on this topic as well as we move forward. It sounds like this is a system that's long overdue, that we're going to need to make a change anyway. So I think getting some confidence that this is the right direction, some input from IT is going to be really important as we discuss this investment. So
Yes, sir.
we'll go ahead and break now, and then get